ACL repairs occur when somebody's torn their ACL, usually with an injury, but surprisingly, a lot of those injuries are non-contact injuries like a rapid deceleration or a twisting injury. However, of course, football players in collision contact sports, a lot of things can get injured. ACL injuries often occur in combination with other structures inside the knee, such as meniscus tears or multiple ligaments injured at the same time. In the past, when somebody tore their ACL, they used to try to repair it. However, that didn't work too well, so now a new one has to be built. In the past, they would try things like synthetic materials, but now they use human tissue. You can use tissue from a cadaver, which is often used, but you can also use your own tissue, such as a portion of your patellar tendon or your hamstring tendons. The risk factors of an ACL surgery are like any other surgery. Of course, you have infection and blood clots, but of course there are things limited to the ACL, such as stiffness. But one of the bigger complications is it not healing properly, often due to not rehabbing it correctly or not protecting it while it's healing. With today's technology, the surgery is much less painful than they used to be in the past. Usually 2 or 3 months of a pretty sore knee and a lot of therapy. But the key is protecting it out to as long as 9 months, because it takes time for the graft or the newly reconstructed ACL to mature and heal. That's the problem, is that a lot of people jump back into activities and sports too quickly, and surprisingly, it's often not painful at 3 or 4 months, but that's when the graft is very prone or at risk not only to re-tear, but just as bad, stretch out. The rehab, in my opinion, is truly the key to recovery. The surgery itself is kind of a no-brainer. Of course, proper technique is important, as is the proper indications and the right patient. But physical therapy truly is the key to recovery. And it is a long process, but there's a lot of science to it, and they've got it down pretty well.